Welcome to Autoimmunity Connects. This is a platform of autoimmunity.in. At autoimmunity.in, we aim to connect patients who are living with autoimmune diseases. We aim to allow them to share their true inspiring stories with us and also share their daily updates on our community on Facebook. Today, we have with us for our next episode, Dr. Suvrat Arya. Dr. Suvrat Arya is a rheumatologist and a clinical immunologist at Arya's Care in Noida. Hi, Dr. Suvrat.
Hello.
Why don't we, as usual, begin with what is autoimmunity to simplify for new viewers on our channel today?
Yeah. So autoimmunity is a state in which our immune system is attacking our own self. Immune system is made to attack intruders like bacteria, viruses, and fungi when they invade our body. But when this immune system is not working normally, it starts recognizing our own cells as foreign and starts attacking them. Then it is called as an autoimmunity state. And the autoimmune diseases can be depending upon which organ is getting affected by the autoimmunity or the immune system damage.
Okay, so today we are discussing something that we commonly know as lupus or SLE. Can you help us understand what is lupus?
Yeah, so lupus is a prototypic autoimmune disease which is characterized by presence of lot of antibodies, particularly ANA, which is also called as anti-nuclear antibody. In this disease, there can be inflammatory damage to probably every organ system of the body, from skin to the joints to the scalp and the internal organs as well. So lupus is basically a chronic systemic autoimmune disease which is characterized by presence of autoantibodies, mainly anti-nuclear antibody.
Right. Is lupus very common in India?
There are many studies for deciphering the prevalence of lupus in India. So the initial studies which were published in 90s, they showed that lupus somehow ranges from 3 per 1 lakh population, and some recent studies have shown from it may be up to 15 to 50 per 1 lakh population. It is little lesser what we see in Western population, but one of the reasons could be underdiagnosed cases in India because of lack of awareness, or probably because of the referral bias that every lupus patient is not able to reach a rheumatologist. So that is why the figures are a little less what we see in the Western population. But generally speaking, lupus is a rare disease. It is not as common as blood pressure or diabetes, which we see day in and day out.
Okay. So if I was somebody who was a little concerned about some symptoms that I was having, and if I wanted to understand that I needed to meet a rheumatologist and explore and understand what was happening to me, what are some symptoms that I should look out for?
Yeah. So the most common symptoms are constitutional symptoms and cutaneous and musculoskeletal symptoms. So the constitutional symptoms include prolonged fever. Not every fever is lupus. Prolonged unexplained fever could be lupus. In India, we have a lot of infections. So when fever comes to our mind, we don't think lupus as the first cause. Then it could be weight loss or lymph node enlargement, which could be small nodules in your neck or in the axilla. The cutaneous and the musculoskeletal features are rather typical of lupus. A patient can have malar rash, which most of the lupus patients know of. It is a redness of the area of your cheeks and the nasal bridge, and the nasal fold is spared. So this is also called as butterfly rash. They can have hair loss, they can have oral and nasal ulcers. So these are very typical features of lupus if as far as skin is concerned. From joints, it can cause pain and swelling of multiple joints from small to large joints. So these are the most common ones. The rarer ones can be renal involvement, in which patient can have protein loss in the urine and swelling of the face or high blood pressure or renal failure. Then even rarer can be CNS involvement, in which patient can present with seizures or stroke-like features or maybe having irretractable headache. And somehow we also see hematological involvement in the form of hemolytic anemias and immune mediated thrombocytopenia. So there are varied manifestations, and that is why it is difficult to diagnose lupus, because there is no one symptom which is classical of it. So yeah, these can be the common symptoms of lupus.
Yes, we also, I think, lupus is one of the more difficult illnesses to diagnose as such because of its quite confusing and multiple systems that it tends to impact before it is actually narrowed down and defined to be a lupus.
Yep.
You mentioned something about the malar rash, or commonly known as the butterfly rash also. Why is it called the butterfly rash, and is it due to some sensitivity to the sun?
Yes. So whatever skin rashes are there in lupus, they are photosensitive. Photosensitivity means that a, a person who has photosensitivity will feel burning sensation. He or she may feel development of a new rash when exposed to sun, and this rash persists. It is not like a very transient rash that you go out in the sun, you have mild redness of the skin, and you come back in the shade and it goes away. No, lupus photosensitive rash can persist for days to weeks after the sun exposure. And sun exposure may not uh, cause damage to skin alone. Sun's exposure to the skin can cause inflammation in the kidneys also. It may sound little weird, but the
Yeah.
persons who experience lupus flare after sun exposure, they can have flare of their renal inflammation also. The reason why it is called butterfly rash, I assume probably because of the shape of this rash, which is like the wings and the nasal bridge. But I'm not aware if there is a deeper story associated with that. I assume it is because of the shape of the rash.
Yes, common information available, through searching online is because it is the typical shape of that
Yeah,
it, and obviously the place where it is at, like right here, and it tends to form that shape. Uh,
yeah.
you mentioned earlier also about seizures. Now, a lupus patient that would whose nervous system is getting affected would be someone who sees seizures. And when and how does this happen?
Okay, CNS involvement is not very common manifestation of a lupus inflammation. It can be there. There are various manifestations which can be there in a patient of lupus who has CNS inflammation.
Mm.
These could be stroke, which may present with paralysis of one side of the body. Then patient can have cognitive dysfunction, irretractable headache, which is not responding to your normal therapy.
Mm.
And then they can also have confusion, delirium. They can also have inflammation of the spinal cord, which may present with paralysis of the lower limbs, which is called as transverse myelitis. They may have myasthenia. So there are a whole lot of things. Seizures are probably the rarer manifestations, even in patients who have CNS manifestation of lupus. So the cause of seizure could be metabolic, could be infection of the brain, or could be related to lupus itself. So once the patient of lupus present with seizure, we have to really investigate in detail that what is the cause and what can be done for that.
Is there a particular age that lupus patients, present themselves in a particular age?
Yeah, yes. So lupus is more commoner in women, up to 9 times, and in women, the women of the reproductive age group, they are more affected. So this age group lies from 15 to 45. So most of the patients will come to us when they have lupus. It may have onset in this age group, but that doesn't mean it cannot occur below 15 or 16 years of age and cannot above 45. But most of the patients will lie in this age group.
Right. So the symptoms of lupus could be also very, very mild. And do they get diagnosed when they're actually quite mild? Because this autoimmune disease seems to be involving a lot of factors in the body. And as you mentioned earlier, it is quite difficult to diagnose. So does one typically see a not so progressive lupus condition in a...
Yeah, yeah. So let me give you an example of diabetes, which is much more common and easy to understand for the general public. So you may have certain people who have just mild diabetes. They will lose weight and they will do exercise and dieting and their diabetes will be under control. Then
Yes.
there will be some people who will take tablets and will eat whatever they want, but still their diabetes will be normal. And there will be some people who will be on insulin and even then they will have complication of diabetes like renal failure or retinopathy or something related to their cardiovascular system.
Mm.
So similarly, lupus is a spectrum. Not every patient will have a life-threatening manifestation like lupus nephritis, which is kidney inflammation, and not everyone will be having very mild disease like just the skin rash. So like 2 days back also I saw a patient who just had malar rash, had mild joint pains, had past history of oral ulcers, and her investigations were supportive of lupus. She is also lupus, and you may see a patient in an ICU setting who has renal failure, who has had seizures, and who is requiring a lot of medicines to manage. And that patient also has lupus. So it is a spectrum. It can be very mild and it can be very severe. So it just depends from person to person.
Right. Does this is this illness hereditary, or can I pass it on to my family just by being around them? And this is top of mind for a lot of people these days, simply because we are in a corona pandemic. So we appreciate that we are. It's possible to pass on a virus or an infection to somebody else.
Okay, so I think there are two aspects to this question. First is whether you can pass it on to your children, and second is it contagious, right?
Yes.
So, see, if a person has lupus, there may be little slight increase of having her children suffering from lupus, but that doesn't mean that it will be definitely be there. Most of our patients of lupus don't have another family member affected with lupus itself, but they have some autoimmune disease in family. Most common of them is hypothyroidism. So when I was in CMC Vellore, we did a study of familial prevalence of autoimmune diseases in patients of lupus and in their families. So we found that hypothyroidism was the most common one. We also saw rheumatoid arthritis, systemic sclerosis, and lupus. And that prevalence was little more than the general population. Not like that if you have lupus, everyone in family is going to develop lupus. It is not like that.
Right.
And secondly, talking of contagious, it is not a infectious disease. It is not caused by a virus which you will transmit to another person whom you are living close to with.
Yes.
Environmental exposures are definitely known to cause or trigger lupus, but somehow it is not seen that uh, transmits from one person to the other as an infectious disease. Some genetic basis and environmental factor may be there, but it does not spread from person to person.
Yes, this is an important factor to discuss, because a lot of the illnesses that we do know about are either something that we get from our parents, like diabetes, and most people tend to say, yeah, okay, so my mom had diabetes, so I have diabetes, and there's nothing new. Or my father had blood pressure, and I have blood pressure, so it's obviously hoga at some point. That's the impression that most of us have as a general public. The other thing that I feel is that disease like HIV, where a lot of stigma is associated with it, that if a person has HIV, you cannot be in the same environment, you cannot share a glass, you can't hug the person. So there are so many stigmas associated with these rare diseases also. And I feel that was important to be brought out, that lupus is something that is a genetically passed on disease, maybe just like a lot of other autoimmune diseases, but it's not contagious, or it's not a virus or an infection that we can pass on by being in the same environment. Um, Someone who has lupus, are they in a greater risk of developing other autoimmune diseases, or in general other diseases?
Okay, so if a person has lupus, they may have a lot of other autoimmune manifestations.
Mhm.
So a person of lupus may have ITP to begin with, which is immune mediated thrombocytopenia, in which platelets are less when it is damaged. So some people may call it that you have ITP also and you have lupus also, but rather I would say ITP is just a manifestation of lupus. So one way to describe is this way, that you may have immune mediated damage to other organs, which you may start calling some other disease, but it is just the part of the lupus. Coming to the other diseases particularly, suppose if a patient has lupus, he may have something called as anti-phospholipid antibody syndrome, which is a different disease because the classification criteria are different, in which there is a tendency to form clots. So around 25 to 30% of patients of lupus can have these antibodies also, and they may be having increased tendency to form clots. So this is a kind of scenario in which you have a disease and you are predisposed to other autoimmune disease. Similarly, hypothyroidism.
Yes.
I presume maybe 50% or more patients of lupus who are on follow-up with me, they would be having hypothyroidism. So that is, we can label that it is not a part of lupus. It is an autoimmune manifestation of thyroiditis that a person has hypothyroidism. So yes, if you have lupus, the chances of having other autoimmune disease little bit goes up.
And that's common across autoimmune diseases. It's like they come in pairs, you know, or they sort of bring the other one along once you get one. What kind of tests does a person have to go through? We talked a little bit, we touched upon ANA. Could you elaborate a bit more on that?
Yeah. So ANA by indirect immunofluorescence is the screening test for the lupus. It is seen positive in around 95 to 99% patients of lupus. There can be patients who may be ANA negative, but most of the patients will be positive for ANA. And then we do a whole lot of panel for ANA, which includes other specific tests like which antigens are giving this ANA test positivity. Then the routine tests for the general public are also important for lupus, like checking the hemoglobin, blood counts, liver, kidney function. There are certain specific tests for lupus like dsDNA complements, which tell us about the disease activity. And then probably the most important will be like a simple test like urine routine, because urine routine is going to tell us whether there is protein coming in the urine or not.
Right.
Unfortunately, I would say that lupus nephritis is more common in India and Indian population as compared to what we see in the Western population in Europe and US. In US, Afro-Americans may be having more disease rather than the Americans only. But in India, lupus nephritis is more as seen as, so urine routine even becomes more important in our setting.
Right. Wow. So we talked about a lot of the how we can diagnose lupus and what are the symptoms, etc. We need to understand that if steroids plays an important role in management and treatment of lupus. We have this perception, and a lot of people have this bias against steroid and steroid-based medicines. Also, a prejudice that if you have an autoimmune disease, you will have to, in every case, take steroids. That which we've discussed in our earlier sessions too, that some illnesses not necessarily, the treatment is not steroid-based, and there are other options too. How about for lupus?
See, for lupus, I would say there are certain life-threatening manifestations that we have no other choice to give high-dose steroids. These can be lupus nephritis, which is kidney inflammation due to lupus. If person has CNS lupus, or have life-threatening low platelet or low hemoglobin. So in this scenario, very high-dose steroids are needed, and they are like life-saving. But if the patient is on oral steroids, the good thing is we have drugs which are called as steroid sparing agents. We as rheumatologists have prime concern of decreasing the dose of steroid as soon as possible to the lowest possible dose. So the moment the disease is under control, we continue to decreasing steroids to the lowest possible dose and introduce another medicine which will take care of what steroids were doing without any steroid related side effects. So yes, milder lupus may not require steroids. Severe lupus with major organ involvement definitely requires steroid, because if we don't give steroids, the damage caused by lupus itself will be much more than the side effects of the steroids.
Right.
So we have to see the risk benefit ratio, and in most of the serious manifestation of lupus, the risk benefit ratio is towards the steroids rather than the disease itself.
So for someone who has lupus, what kind of financial pressure does it become on him or her or the family once you get diagnosed with lupus?
Okay, so again, it depends on what kind of manifestations lupus has. If it is like mild disease limited to joints and skin only, then the cost of therapy is not much, just like routine arthritis management, maybe 1,000 to 1,500 a month,
Right.
not more than that. If a patient has severe lupus requiring kidney biopsy, admission, and therapy for renal inflammation, then it depends, because we have lot of options. We have certain drugs which are not very costly and they will have similar action, and we have certain medicines which are little less toxic, but the cost may be a little more. So again, it depends from patient to patient. If a lupus patient is very sick, requiring ICU admission
Then
or requiring a prolonged admission due to hospital care, then again the cost may go up.
in this conversation, I noticed that there is a huge play of the kidney. Uh, is that a common thing with lupus patients? Because that seems to have come up quite one or two times in this discussion. Does kidney have a huge role to play for a lupus patient?
Yes, because when a lupus patient is diagnosed with SLE, the renal inflammation, the chances of renal inflammation are maximum during the first 3-4 years of diagnosis. So
Mm-hmm.
we have to be very careful during these time to regularly monitor the patient for development of lupus nephritis. So how will lupus nephritis may present is presence of protein in the urine, presence of RBCs, that is blood in the urine, or elevation of blood pressure. So checking blood pressure is very important for a lupus patient. And then there can be certain indirect evidences of having protein leakage in the urine. When a person may get up in the morning, they have swelling around the eyes, or when they generally they may be having swelling over their feet. So this means that the patient may be losing protein in the urine.
Right.
So for our patients, like I told you, in Indian continent, in Indian subcontinent,
Hmm.
our patients have more of lupus nephritis as compared to Western population. So we need to be very careful on that.
Right. So the kidney does have a huge role to play as far as Indian patients or patients
Yes,
come in our city, in our continent with lupus.
yes.
Um, so obviously, after this discussion, we've kind of come to understand that when a person is diagnosed with lupus, there are many things that tend to impact his or her life. Uh, what should a person truly expect? Because I presume they would be living with some amount of pain before they come to the expert or the rheumatologist and are able to and have gone through various tests while they get diagnosed with this, and a specific diagnosis is then defined as lupus. A lot of things have already happened, but in a long-term basis, what should a person expect? What kind of changes should they expect in their life once they start getting treated, diagnosed and treated for lupus?
See, lupus is a chronic disease. So first and foremost, it should be acceptance to the disease. Otherwise, frustration will creep in. A patient may start feeling or saying, why only me?
Right.
So we try to tell them that you are not alone. There are a lot of patients who suffer from this disease. And with regular treatment and regular follow-up with medicines, it can be controlled. The inflammation of the disease can be controlled. Even lot of lupus nephritis patients, which is, I'm again specifying that it is a more severe complication.
Yes.
Lot of patients, when we are able to control the renal damage or renal inflammation by the induction therapy, and when we start the maintenance treatment, they are able to manage and they do very well. So I would say it is a chronic illness which requires regular treatment and regular follow-up. So don't get frustrated. Just clear your doubts with your treating rheumatologist,
Yes.
and be in touch with other patients who have this disease. and then let us just follow it up and let us see how it goes.
Yeah. Okay. So the world doesn't come to an end if you have lupus, because it seems to be one of the more serious autoimmune diseases from the ones we have discussed earlier. You mentioned something about a flare. What is a flare when you talk about lupus?
Yeah. So whenever there is worsening of organ inflammations of lupus, then we say that a flare is there. So it can be a cutaneous flare. That means only the skin rash is coming up or the skin inflammation is going up. There can be a renal flare in which there can be again coming up of proteins in the urine or blood in the urine
Right.
or BP shooting up,
Right.
or they can be like musculoskeletal flare, like arthritis only flaring up. And there are certain blood tests which tell us about the lupus activity. Lot of autoimmune diseases don't have such blood tests that can tell us the activity of that disease, but for lupus we have two tests which are very commonly used in our day-to-day practice. One is anti-dsDNA and serum complements, which we have discussed earlier also. So
Yes.
these tests usually support the diagnosis of a flare. So the flare can occur if you have sun exposure, like I told you, skin can worsen and internal organs can also worsen. Then flare can also occur if you're non-compliant, or if intrinsically disease itself is having a severe course, it may have a flare.
Right. Um, can a lupus warrior plan a family? Is there any kind of certain things that need to be taken care of while planning a family for a lupus patient?
Yes, definitely. Because see, like 9:1 is the ratio for females to males. So for
Right.
females, they who are going to carry pregnancy, it is very important if you have lupus.
Right.
First and foremost is lupus should be in remission for at least 6 months. If lupus is active, don't plan a pregnancy, because there is a twofold problem. One is you may have a tough time because lupus is already in a flare, and the pregnancy outcome is also not going to be good. So
Right.
lupus has to be in remission. Secondly, what medicines you are taking is also very important. Certain medicines are there in which pregnancy cannot be planned because these medicines have bad effect on the growing fetus. So those medicines have to be changed way before you plan a pregnancy, maybe 3 to 6 months before planning pregnancy. Then is what lupus can do. There are certain tests which we can tell us, like we discussed about antiphospholipid antibodies.
Yeah.
So if these are positive, then there are chances the lupus patient may have abortion or recurrent abortion. So we need to give them blood thinners or anticoagulants to sustain the pregnancy. And
Mhm.
then there is one test which is called as anti-Ro antibody. Now this may be associated with uh, heart conduction problem of the growing fetus. So
Mhm.
if the mother has anti-Ro antibodies, then regular fetal echocardiography, that is echocardiography of the growing child, has to be done. So these are probably the four most important aspects of lupus and pregnancy.
So, if we were to simplify it, in a very normal kind of a situation, I think a lady or a woman with lupus is definitely in a compromised situation as far as family planning is concerned. And I believe consistent monitoring is the only way that she can hope to have a healthy, normal child.
Right.
Uh, so that is one of, I guess, one of the most important things that a lupus patient will have to accept in their life. Other than that, when we come across any autoimmune diseases, a lot of people recommend to us various diet changes and various exercise regimes. How helpful is this as far as a lupus patient is concerned?
As far as exercise is concerned, it is going to be helpful because uh, you have to be fit physically and mentally
Mm-hmm.
to manage lupus. If you are overweight, if you have obese, the inflammation in the blood is also going to be worse.
Right.
So you have to maintain a good weight. You have to do regular exercise to have a healthy lifestyle. And as far as diet is concerned, I would say a healthy balanced diet is the one which is most important.
Right.
Not like that you should not eat this, you should not eat that, not like that. You should have a healthy balanced diet. You should avoid processed foods, high sugars, and high fats. These are known to worsen inflammation in the blood. So you should avoid these. You should take more of antioxidants, and you may be taking more of omega-3 fatty acids.
Right.
So the natural things which are rich in these are fresh fruits and vegetables. They are rich in antioxidants. You can take sprouts, you can take almonds, walnuts, chia seeds, flax seeds, and soybean, avocado. And in non-vegetarian diet, you have fish and fish oil. So
Yes.
these are the things which may be a little bit helpful in managing this. But yeah, there is no substitute to medical therapy in diet. It may be just supportive.
Right. And exercise, yoga, physiotherapy, regular exercise. Uh,
Yes,
how,
yes.
how
So
possible?
I told you about exercise, that yeah, being fit is important, not being overweight is important.
Right.
Yoga, deep breathing exercises, pranayam, all of these have shown good effect. Some studies have been done in which they have shown yoga and pranayam having good effect on lupus, and they help us in by decreasing the stress level, increasing flexibility, and also give you a sense of well-being. So yeah, these are also important adjuncts to the medical therapy.
Yes. We are all concerned about corona today, and as an autoimmune patient, one tends to be more conscious about not being in an environment to put, expose yourself to extra risk. How much extra risk is an autoimmune patient in these conditions?
Okay, so firstly, the chances of getting the virus is probably not more, because uh, the probability of virus reaching you is same as that of a general population. But if you get it, you may have a little more severe course as compared to a general person
Yes.
who may not be having an autoimmune disease and who may not be on immunosuppressive therapy.
Yeah.
So we have already discussed in our one of the previous sessions that how immunity and autoimmunity are involved in the management of COVID and coronavirus exposure. So I would say that immunosuppressive therapy is being used to manage severe symptoms of COVID. So it is actually a very tricky situation now, that a person who is already on immunosuppressive, how will he respond?
Yeah.
So see, initial fight against COVID is by our own immune system. So all the patients of autoimmune illnesses who are on immunosuppressive therapy, they must be in constant touch with their treating rheumatologist, so as to they can figure out what is best for them. I have few patients of rheumatoid arthritis who developed COVID and they have recovered very well without any problem. But
Right.
we just had to fine tune their medicines and just to take care of them through this illness, and they recovered well. So this goes for all the patients of autoimmune illnesses.
Yeah. So a good thing to do is continue to maintain the social distancing, the sanitizing, the wearing of the mask, and good, great ventilation wherever you go, especially if you are living with an autoimmune disease. There is no need to be extra scared, but if you get it, then it becomes imperative that you have, that you'll have to be managed for the coronavirus, in addition to try and balance the impact of the autoimmune disease on all the medications that need to be pumped into you. So that is,
Right.
yeah. So technically, you're not at greater risk, but it would be wise to just take more care. We Autoimmune diseases are very challenging, I think, for people who live with them. In this platform, we strive to have these expert conversations so that people understand what, for example, in this case, lupus is about, and are able to maybe get themselves diagnosed faster once they appreciate what the repeat chronic symptoms are. And if they question themselves, then they can get themselves over to an expert. So generally, we want to build awareness. But also, we would like to, our main aim is to be able to provide peer support to people who are living with autoimmune diseases. How important do you think is this peer support, or the ability to have a platform where you can go and talk to someone for a lupus patient?
Yeah.
How important do you think and relevant do you think it is for him or her?
Yeah. So like for the previous sessions also, I'm going to repeat my experience which I had at previous institutes. At CMC Vellore and at SGPGI Lucknow, I observed that the patient waiting area is a very interesting place where patients talk to each other, share their stories, discuss what they have gone through, and they support each other. People coming from same locality started coming together, started being friends, and their families also became friends. So when a person who has gone through the disease and they share their experience with someone who is going through it, then probably that advice is the most precious, more precious than what a doctor suggests them to like follow or do. For chronic autoimmune diseases, commonly we see that patients, when they become good or better, they stop the medicine. And again, just to have a flare of the disease. Because when they start feeling better, they assume that the disease has gone, but actually it was just the effect of the medicines. So in this kind of a scenario, this kind of a peer support really, really helps, because someone who has gone through this can counsel his or her friend, other patient, that see, I have gone through this,
Yes.
and this is what may occur if you stop it, and then you be compliant with the therapy.
Yes.
And this kind of a support, knowing that there are other people who suffer from the same problem, that you are not alone, you know someone who has gone through this, gives a lot of mental strength to patients, and they can share their stories, their experiences. Some of the people of ankylosing spondylitis were bedbound, and we encourage them to undergo hip replacement or some surgeries at young age, and now they are totally self-dependent, they are earning, they are working well. There are a few patients I know. So but rather than we convincing, we ask them to speak to someone who had undergone the same thing.
Mm.
And the difference is huge when someone who has this shares their experience with them. So
Yes.
I think that your platform will be an amazing area for people to connect with autoimmune diseases. And it is actually a need of the hour in India, because we have some support groups, but they are not as at a larger scale as compared to what we see in Western countries like Europe or US. Because there, the moment a patient is diagnosed with a disease, he or she is advised to get attached or get in touch with some support groups,
Yes.
and that is a huge difference, which makes their outlook about the disease, their outlook towards their life. So I think probably it is one of the most important aspects of management of autoimmune diseases, chronic autoimmune diseases.
Yes. We aim at autoimmunity.in to be able to provide that platform for people to be able to ask stupid questions also and get answers. Sometimes patients tend to get conscious in front of doctors, and sometimes it is very overwhelming to get all this information. Some doctors are not able to put it to a patient very simply also. So the patient is sitting there absorbing everything and really not understanding any of it. Those kind of things also can get facilitated through this platform, where if another human being or if another person is available just to do a random chat, that have you gone through something like this and how have you lived with it, or how have you managed a flare. You're absolutely right that in the West, this is by default done by doctors also. That the moment you get diagnosed with a chronic illness, they immediately attach you to a support group, or they encourage you and they give you information, pamphlets, and generate awareness that you can go and speak. But in India, culturally, we are not that open about our illnesses. First, it takes a long time to accept that we have an illness, and then to be able to announce to the world or in any platform that this illness is there is a big challenge. The other thing I feel also, and you may correct me here, is that a lot of patients come from not so high socioeconomic backgrounds. So their understanding, their availability of medical facilities, their availability to medicines, and forget the concept of being having an online platform or to talk to someone, is very, very rare in itself. So as we increase the understanding of autoimmune diseases with in India per se, and generate a lot of awareness, I hope that doctors as yourself are able to give and proactively give information about any one of the support groups available relevant for that person, so that he's able to feel a sense of belonging. And I think that's the most powerful a platform to have a sense of belonging. All of us love a sense of belonging. So if everybody watching this video here is able to understand what we're trying to do and would like to support, take a minute and please do like, please do share, please do comment. Let us know what you want to hear more about from Dr. Suvrat as well as myself. What would you like us to cover on this platform? And don't forget to subscribe to this channel. Thank you very much. Have a safe day.
Thank you.
Thank you, Dr. Suvrat.